Hello. In this short video, we're going to be talking about some of our work relating to the importance of communicating with children about illness and death, particularly during the COVID-19 pandemic. My name is Dr. Louise Dalton, and I'm a clinical psychologist at the Department of Psychiatry, and my colleague, Dr. Elizabeth Raper, who's a senior postdoctoral researcher, will also be sharing part of this talk with me. We wanted to start today with the words of a child, voiced by an actress, speaking about her experience of the current pandemic.
I know that coronavirus means that I can't go to school and I can't play with my friends. I know it means I can't see my grandma and everyone has to wash their hands all the time. I know it makes people really sick and lots of people have died. But I don't understand why my brother is so grumpy, even though he normally hates school, and why my mum and dad are arguing, even though they think I can't hear them.
I think this beautifully encapsulates children's experiences. They have a lot of knowledge about COVID-19, the practical implications, the importance of social distancing and hand washing. But what is less clear is the emotional ramifications of the pandemic and how this is affecting the behaviour of the members of her family around her. Our conversations are entirely dominated by the pandemic, and our media is absolutely saturated with news of hospitalisations, death tolls, restrictions, local lockdowns. In our social world, every conversation starts with how people are surviving and the stresses and strains of lockdown. There have been many very high quality animations and books for children of all ages about the virus, including the importance of hand washing and social distancing. But crucially, children are also subject to adults' reactions to world events, their fears for the future and how this will affect society for many years to come. At the same time, the familiarity of children's routines and their day-to-day activities have been completely disrupted. There's been no school for months, very limited contact with peers, and children's clubs and activities, if they're happening at all, look very different, and ballet or scouts via Zoom doesn't feel quite the same. This social infrastructure is critical to children's well-being. In our past lives, when children were facing individual psychological challenges or stresses within the family, these structures, particularly schools, provided a refuge of familiarity, and as such, they're absolutely crucial to children's resilience in the face of adversity. Parents would do anything to protect their children from distress, but children are astute observers and notice even small changes in the world around them. Phone calls behind closed doors, words said in whispers, changes in rules or in adults' mood, and unexpected absences. So children really do need explanations for what they observe. When these are absent, children draw their own conclusions, which can be more dire than the truth. Sophia Ratcliffe writes very powerfully about this in her book, The Lost Properties of Love, describing her experience of sleeping on the landing outside her parents' bedroom as a child to protect the family from burglars, whereas the threat was actually the secret that her father had cancer. Children's understanding of illness and death gradually evolves with development, so information needs to be tailored to their age and level of comprehension. Even infants are attuned to subtle changes in the responsiveness of their caregiver. Under-twos will notice the absence of familiar caregivers, whereas by 3 or 4 years of age, children understand the idea that living things die, but not that death is irreversible. Therefore, it's important to repeat that someone who has died cannot and will not return. Magical thinking is a stage that's typical in children of 4 to 7 years old. This means that children may link unrelated events, such as believing that their own behaviour or thoughts have caused a parent to become ill. I'll never forget the story of a boy whose mother had HIV. One morning as a young child, he was refusing to go to school, even though he knew it would cause her to miss her clinic appointment. Many years later, after she had sadly died, the boy confessed that he had always blamed himself. "It's my fault," he said. "I was naughty that day, and so I am responsible for her death." Adults have a much more sophisticated understanding of illness and death, but some of the normal tasks of adolescence, so gradually achieving independence and autonomy, can be significantly disrupted by illness within the family. We only have to think of the current social distancing rules and how these are completely contrary to adolescents' needs and priorities to be with their friends. And when a member of the family becomes unwell, an adolescent can get pulled back into the family just as they're kind of trying to find and spread their own wings and find their own independence. So in the context of the brief overview of children's developmental capabilities at different ages, we'll turn now to think about how adults can support children's mental health during COVID-19. Many adults can feel fearful about how to talk to children about such sensitive issues, but the best place to start is by listening to children and asking what they understand already. Adults can then provide children with concrete and specific information to answer their questions or clear up misunderstandings. Although we can often use euphemisms to talk about death, these can cause confusion. For example, if we tell a child that we lost Grandpa last night, then a child may well expect that he can be found again if only people could search hard enough for him. It's also important for adults to be authentic about their own feelings. This helps children understand the possible changes in adults' behaviour and also provides them with a model of how to talk about their own feelings. It can be very helpful to normalise children's common emotional and behavioural reactions to the pandemic. For example, I think a lot of children are feeling sad and frustrated they can't see their friends at the moment. We should also anticipate that children's behaviour may well deteriorate as they experience strong feelings of sadness, anxiety or frustration, and recognising to ourselves that these experiences and emotions are driving uncharacteristic outbursts or clinginess can help us respond compassionately as the adults around them. Whilst recognising the challenges of the situation, it's also essential to be positive and reassuring with children, talking about what we can do and reflect on what activities can help if they're feeling worried or low. In summary, opening these lines of communication with children enables us to support children with their worries, so they're not faced with managing these life-changing circumstances on their own. Our group in Oxford frequently collaborates with A Better Start in Blackpool, and together we produced a short video to support parents talking to children with under 5 about COVID-19. And you can find a separate link to this video also on the HealthVest website.
So in 2019, our group in the Department of Psychiatry at Oxford published 2 invited reviews synthesising the global evidence about communicating with children. One was concerned with children's own life-threatening condition, and the other about life-threatening illness in a parent. And the key conclusions from these reviews was that the effectiveness of communication has long-term impacts for the psychological well-being of children, families, and healthcare staff. So just to give you a bit of a brief overview of this work, we showed that effective communication with children about their own illness was associated with better cooperation and adherence to treatment. Children with cancer who had been carefully told about their diagnosis had lower reported symptoms of anxiety and depression. For children with HIV, disclosure of their diagnosis was associated with lower levels of anxiety, better functioning socially, and a small but significant decrease in depression. Children who had not been told of their diagnosis, we found had increased levels of reported emotional difficulties. Returning to our previous point about children being acute observers, a large Chinese study found that less than 40% of children had been told that their parent was HIV positive. But strikingly, however, of those who were not being told, 80% of them were actually aware of their parents' HIV status. So not telling children does not mean they don't know and does not protect them. Consistent with the paediatric literature that I described, children who had been told about their parents' illness had lower reported depression and anxiety, and poorer disclosure of illness was associated with increased behavioural problems. This review, the reviews that we made, concluded with a framework of guidelines developed by an international expert group to help healthcare professionals prepare and structure these conversations. So now, thinking about the circumstances around COVID and what the pandemic presents to us, we know that it poses a number of very specific challenges for communication about life-threatening conditions or even the death of a patient. Patients are usually alone in hospital without visiting family members or friends. And then this means that healthcare professions have very few opportunities to develop relationships with the relatives and find out any children who may be important to that patient. Patients' relationships with children may extend well beyond our traditional family group, e.g. a former step-parent, a neighbour or a cricket coach. And the absence of opportunities for staff to get to know the social network of their patients exacerbates the invisibility of children. Furthermore, the news of a patient's serious illness or death must now be conveyed by telephone rather than face-to-face. So in turn, families are left to share this life-changing news with children. And with the current restrictions of lockdown changing all the time, adults have very little time or privacy to prepare how and what they want to tell children. Our team at Oxford were approached by local hospital staff who already knew of our work from our Lancet reviews that I just described, and asked if we could help provide support to healthcare professionals in telling people someone had died of COVID-19. Using our Lancet framework as a base, we have now created a platform of free resources for everyone to download and share, which includes step-by-step guides and animations for healthcare professionals and care home staff to take them through what they have to say when calling a relative. What was absolutely critical to us was to include a step in these guides that identifies if the patient had any important relationships with any children. We know that the professionals having to tell relatives that a loved one has died that they may never have met the family, so they have no idea of the family setup. Equally, the families are told this life-changing news and have little or no time to prepare how they are going to tell any children in the family. We therefore also created a specific guide and animation for families, which staff can then email or text to them, which supports the family in talking to any children affected by the death. This also includes suggested phrases and words that can be used. We also thought that school staff could equally be faced with trying to answer difficult questions from children during the school day. Teachers are seen as key role models for many children, and they may even feel more comfortable asking their teachers questions about death or voicing concerns that they have at home that they don't really want to talk about in case they think they're going to worry their own parents. Although we know teachers have a vast experience with dealing with bereavement, we felt that they might need some extra reassurance if children ask difficult or tricky questions specifically about illness and death. So again, we have created a guide for teachers highlighting what children understand at different ages and how they can manage these sensitive topics. These resources have been translated into multiple languages and have been cascaded through our collaborators and networks, but we are always looking for any help with increasing their dissemination and reach, as it's so important to us that they get to the right people. Equally, we really do encourage feedback and are happy to modify the guides to make them more relevant to different settings. So imagine for a moment that you've just received a phone call to say that your mother has died from coronavirus. Your two children are downstairs, well aware that you've answered a phone behind closed doors. In the immediacy of your own shock and distress, you now need to walk downstairs and tell the children this life-changing news. We have made all these resources with this moment in mind, with the aim of making these seemingly impossible conversations possible.